Polio is a crippling and even fatal disease which is caused by the poliovirus. This is a very contagious disease and is spread by direct contact or from infectious air. There are 4 stages of this infection, which depend on the severity of the disease, and the symptoms also worsen in each state. The vaccine is the only precaution against polio. Let's understand in detail the severity of polio, its treatment procedures, complications, and prevention. What is meant by polio? A virus affects the brain or spinal cord's nerves, leading to an illness known as polio. In this condition, a person becomes unable to move correctly. Certain limbs do not work, leading to paralysis. Sometimes, breathing issues could happen during this condition. It's not only a disabling condition, but could also be life-threatening. Therefore, it's also known as poliomyelitis. The first known name of polio was millennia, described by a British doctor, Michael Underwood. However, it was recognized by German physician Jacob Hein. It's an ancient disease, as Egyptian images show some pictures of walking children with canes. Hence, the world is fighting polio a long way. A report recommends that in 1988, there were 350,000 cases of wild polio, as 1,000 children become paralyzed per day. The polio vaccine has prevented polio, therefore. The 2021 July report indicates just 2 polio cases worldwide. How is the poliovirus transferred? Polio is a contagious disease because it causes the virus to spread easily and quickly. It transfers direct content from one person to another people. This virus is present in the intestine or throat of the affected person. Poliovirus enters the body of an infected person by mouth. An infected person may take it through the infected air or come into contact with the poop of the infected person. Infectious air means that when a poliovirus-containing person sneezes or coughs, he drops germs outside, affecting the air quality. In return, when a healthy person breathes in the air, he may inhale that virus into his body. When someone's feces touch their hands or his mouth, he may take poliovirus. An infected person can transfer the poliovirus to other healthy people just before or after 2 weeks of symptom appearance. Do you know the leading cause of polio? The leading cause of polio is a virus known as the poliovirus. Poliovirus targets the spinal cord nerves and brainstem, which control muscles in the body. The naturally occurring polio is known as wild-type polio. It eliminates itself in most regions. Another virus is the vaccine-derived poliovirus. It's the most widespread virus, and it causes more infections worldwide. Vaccine-derived poliovirus mainly comes from an oral vaccine with weak poliovirus. This weak virus does not cause poliovirus directly. It only happens in some countries where oral vaccines are given. The weakened virus does not directly cause polio or any illness but spreads. It causes polio in those areas where most people are not vaccinated because, in these communities, it's not controlled. This weakened virus can last longer and behaves like a wild-type virus. Persons who experience this virus have weak immune systems or are not vaccinated. Stages of polio. There are 4 states of polio, depending upon the severity of the disease. About 5% of poliovirus affected people live with a mild disease known as abortive poliomyelitis. The most severe stage of polio is non-paralytic polio. About 1% of people with polio belong to this stage. After crossing the non-paralytic stage, the disease becomes more severe and is known as paralytic polio, when problems progress and new symptoms appear. This stage of polio is known as post-polio syndrome. This happens after 10 to 20 years of polio-experienced patients. What are the symptoms of polio? Each state of polio expresses different symptoms. Abortive polio has flu-like symptoms that occur in 2 or 3 days. Its symptoms include fever, headache, throat soreness, appetite loss, nausea, and vomiting. A non-paralytic polio state is more severe than an abortive state, but it does not cause paralysis. Pain in the neck, headache, and aching are the further symptoms of non-paralytic polio. Before the second state or phase, A person seems to be getting cured. At this, he experiences spine stiffness, weak muscles. The paralytic phase is the most severe case of polio. In this state, a person experiences severe pain, becomes sensitive to touch, muscles twitch, and weak muscles, even leading to limb paralysis. Combined paralysis may occur in both legs, but one leg or arm commonly becomes paralyzed. This state includes more severe symptoms, such as muscle paralysis, which even leads to breathing and swallowing issues. The next most severe stage occupies more symptoms: fatigue, joint or muscle weakness, weak immunity, sleep apnea, and swallowing issues. How is polio diagnosed? The healthcare provider diagnoses polio by its symptoms: neck or back stiffness, or any abnormal reflexes or weakness in muscles. A stool test is also recommended to detect the poliovirus. As we know, poliovirus is primarily present in the throat of the affected person, so a throat sample is also tested. However, a throat sample test is taken in the first week of polio occurrence. Cerebrospinal fluid is also tested. This fluid is present outside the brain and spinal cord. Describe the treatment procedure used to treat polio. There is no focused cure for polio, so doctors' primary focus is prevention and relief of symptoms. Healthcare providers focused on preventing complications. Other supportive treatments include physical therapy to prevent bone deformation, take complete bed rest, pain relievers. Ventilators are recommended for smooth breathing. Use splints that encourage the affected person's position. How could polio be prevented? You may prevent polio if you are entirely immunized by poliovirus. Make sure to take care of proper hygiene of the hands and respiratory system, which could be done by washing hands repeatedly, avoiding drinking alcohol, coughing or sneezing on tissues or elbows. Polio vaccine. Vaccination is recommended in 4 stages: at 2 months, 4 months, 6 and 18 months, and at age 4 or 6. Adults usually have immunity to poliovirus. They have little chance of exposure. If someone is completely vaccinated, he may get 1 intravenous poliovirus, but if he is not, he should take 3 doses. In adults, the second dose is just after the first one. The third dose is 6 to 12 months after the second dose. What are the complications associated with polio? The severe state of polio, which affects someone's breath, can cause the death of that person. If it does not recover by itself, its long-term presence can cause complications that usually do not recover. These may include shorten the muscles, which could lead to deformed bones, severe chronic pain that lasts every time, permanent paralysis. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.